I'm Dr. Matthews. I'm going to be doing your cranial nerve exam this evening. Have you had one before? Okay, so it was a while ago. So maybe you've got a rough idea of what to expect. I'll give you a quick overview. We are going to be checking your primary senses, your sense of smell, your vision, your hearing a little bit, and we're going to check your muscular response. This is making sure your nerves are sending the right signals to your brain and your brain is executing them properly. Okay. First of all, we're going to get the basics out of the way. I want to have a listen to your heart and your lungs, okay? Just check you're nice and healthy. Do you know your blood pressure? Okay, we can find that out. Alright, so this is just going to go about here. It's not invasive, but I will need you to breathe nice and slowly. Really try and fill your chest cavity up, because I need to hear inside there, alright? Alright, okay. Just going to start here. Big deep breath. Just hold it a little longer. Okay, let it out. Good. Sorry, I'm just going to ask you to undo one of these buttons. I'll try and be as non-invasive as possible. There we go. Another big deep breath in. Okay, that's very good. Just gonna come around the back, if that's okay. Actually, if you just turn around slightly, that's much easier. Alright, just gonna press this here. That's great if you can just keep that nice slow breathing pattern going. Really fill up your lungs. Good. And here. Okay, this time I'd like you to do a little cough. Once again. One more time. Alright. Now I'm going to listen to your heart. Would you like me to do it on your chest or your neck? Some people aren't comfortable with the, chest being touched. It is an awkward place to get to. Okay, we'll do it on your neck then. I'm just going to press this very gently around to where your pulse is. There we go. Nice and loud in the stethoscope. Okay, so for this I need you to relax, if you're not already. Nice, slow, big, deep breaths in. If you're not relaxed, it can artificially elevate your heart rate and give a false reading. So I need to know what it's like at rest. So just rest. Nice, slow, big, deep breaths in. Just letting it out slowly. Very good. Nearly done. We need a minute to pass to count the beats per minute. Okay, good. Hovering around 70. It's a good resting heart rate. When I was really unfit, mine was like 90 and then managed to get it down to about 55. Some athletes have a resting heart rate in the 40s, which is mental. Okay, and on your chart it has your name and address, but it doesn't have your height and weight. Do you mind just pushing back against the wall, standing up as straight as you can? I'm just gonna... Gonna take a few of these just to make sure. 9 centimeters. Really standing up straight. Good. Okay. So we can relax a little bit now. You can sit back in your chair. Do you mind if I take my jacket off? It's been running around like a headless chicken all day and it gets warm in here. Okay. That's better. Okay. This is a rather easy test. Well, they're all quite easy. I'd like you to close your eyes in a moment, and I'm going to be touching on various points over your face with this paintbrush. This is the bristle side, we'll call that the soft side, and then this is the wooden side, we'll call that the hard side, okay? I'm just going to press it at various points over your face, and you let me know whether it's hard or soft, okay? Okay, eyes closed, very good. It's soft or hard? Soft or hard side? And here, and here, 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 good, here, 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 very, very good. Now we're going to check if you can differentiate temperature. I've got a such a hearing tuning fork, but it's made of metal, so this end is cold. Obviously the paintbrush is made of wood and it's room temperature, so we'll call that warm, right? So I'd like you to again close your eyes. I'm going to touch you at various points and you just say cold or warm, alright? Eyes closed. Cold or warm? Is this the cold side or the warm side? And here, and here, cold or warm? Cold or warm? Just gonna turn on your ear. Cold or warm? Cold or warm? And lastly, cold or warm? Good. So far so good. I am going to get you to pull some facial expressions now. Some of them might feel a little bit silly, but I'm just making sure that all the musculature in your face and your nerves are working correctly. So I'd like you to squeeze your eyes shut as hard as you can. Very, very good. Now open them really wide. Okay, good. Raise your eyebrows and frown like the Rock. That's the Rock. Can you do that? Can you raise one eyebrow? Very, very good. Can you raise the other eyebrow? That's hard. Okay, well your eyebrows are working correctly. That's very, very good. Scrunch up your nose. I'm just going to press around the orbital rim. That's this bit of your eye socket here. And you just tell me if there's any tenderness or soreness, okay? All good? Okay. I'd like you to flare your nostrils if you can. Okay. Now, grip your jaw tight. Clench it. Again. Open really wide. Any pain around here? Any pain? Okay. Very, very good. I'd like you to turn your head all the way as far as it will go to the left. My left, your right. Very, very good. And we're going to do the same thing that way, okay? As far as it'll go. Okay, now shrug your shoulders up as high as they'll go. Okay, this feels nice and secure. Doesn't feel like you're withering away. No atrophy as far as I can tell. Okay, if you can put out your hands in front of you like this, I'd like you to start off by splaying your fingers. Very good. I'm gonna just lightly push against them. Yeah, seems strong, all fine. Now crunch them together. Make a fist. And over here. Very good. I like you to T-pose if you can. Just putting both arms out like this. And raise them up slightly like this. And I'm going to push down against them, okay? Don't let me move them. Very good. Seems absolutely fine. Now we're going to do the opposite. Now you're going to try and pull them together. And I'm going to add a little light resistance. Any pain or aches there from doing that? No? Good. Tendons all seem like they're working correctly. That's fine. It's going to have another look at your hands. Nails look in fine shape. I don't see any dry skin or yellowness, brittleness, snapping. They all seem to be healthy. Cuticles look healthy. A little bit of we've got calluses on the inside, but so have I from weightlifting. But besides that, hands all fine. And most importantly, the nerves that control your hands seem to be fine. Shall we do your eyes? Okay, I need to get my light for that. I'm going to start off with a little yellow light like this. It's not very strong. It's not meant to be very strong. Just look here. Just follow the light with your eyes, okay? Don't move your head. Just looking with your eyes. Well, eye. Keep focusing, keep focusing, keep focusing. Any double vision? Keep focusing, good. Cover this eye, okay. And same again, I'd like you to focus on the light. Don't move your head. Just move your eyes, very good. Just following the light wherever it goes, very good. Okay, now keep focusing, keep focusing, keep focusing, keep focusing, good. I'm going to switch to a slightly brighter light. Just going to come a little bit closer. Really sorry if this is bright. Just trying to see if the back of your eyes are okay. They don't seem to be inflamed. There's tiny little blood vessels that we trace back. We start with one and then trace it. And if they're extra red, then it's a sign of high blood pressure, but they're not extra red. They seem to be a healthy shade. Okay, just looking here. I would like you to put your hand directly in the middle of your face like this. Make a little wall. Very good. Okay, now focus on a spot behind me or my ear, basically in a forward direction, okay? Again, I just need to come a little closer. Consensual response looks good. Yeah, the consensual response is basically your other eye. Even though it's not exposed to the light, it does the same thing. And then of course we've got the direct response, which is just your pupil dilating as we shine a very bright light in it. Okay, give a little rest for your eyes. Blink. Don't forget to blink. Okay, I'm going to be doing the same again, just kind of focusing somewhere Looks like the bat signal, doesn't it? You've got to have fun at work, don't you? Good, look there. Thank you. Pupil constriction seems a little bit delayed, actually. Well, there is always a delay, but it seems outside of the bounds of what I would call normal delay. No, I wouldn't say it's a mark of anything serious. It's just something we need to investigate further. Is Cherry consensual? Yeah, that's fine. Your right eye seems to be completely normal. Your left eye isn't far behind, but it is noticeably slower. I'm gonna have to take a closer look in the back of your eyes, I'm afraid. This is going to involve me coming even closer. Luckily for you, I haven't had my lunch yet, so I don't have so much breath. Hopefully you find it minty fresh. Okay, if you could just start by looking at the light. Okay. Yep, we are very close to each other. You sort of get used to it when you do this day in, day out, but some people find it really relaxing, some people find it uncomfortable. To be honest, I'm not really focusing on that. Could you look up for me, please? Corneal bulge looks nice and healthy. Tear ducts don't look to be inflamed or red. Have you had any experience with eye diseases, like an infection? No? That's good. Yeah, it's really, really horrible. I had it once. They go gunky. It's disgusting. Luckily, it's just a virus. It passes. Okay, look down for me. Look to your left. Now look over to your right. Look diagonally up and left. Up and right. Down and left. And then lastly down and right. And then back to the center. Now just looking directly at my light. Okay, good. We're going to do this eye now, which means I need to switch. Yeah, we always have the same eye matching. So if I'm looking in this eye, then I'm here. If I'm looking in this eye, I'm over here. So we have a nice mirror going on. Okay, same again for your right side. If I can get you in focus. Okay. If you could look at the light. And just start by looking down. And to the left. And over to the right. And down and left. Down and right. Corneal bulge looks nice and healthy again. Tear ducts don't look to be gunky or infected, which is fantastic. Yeah. If they're dry, that could be caused by not getting enough sleep, overtiredness. You could just look up and right. Okay, and up and left. Now I'm just looking at my ear. spots on your vision? No, you want to shine the light directly in your eye. Okay. Any double vision here? And at any point, does it trigger double vision? No, stays a single. That's great. Just quickly. Same over here. Any double vision? Just focusing on my finger really hard. Yeah, this is the side with the slightly less speedy reactions. I think I have an idea what it is there. There's nothing to worry about. Any spots when I shine the light directly into your eyes? Any spots? No. Good. Yes, I know the eye portion takes a while. They're quite complex things, aren't they? Eyes. Got quite a lot to check. Okay, so looking here and covering one of your eyes, I am going to be holding up numbers on my hands. Actually, no, we'll do the wiggle test. Okay, so I'm going to wiggle one hand on each side, and you're just going to look here because we're going to test your peripheral vision, right? So try to do the opposite of what we did before. Don't look at it, all right? Just looking straight ahead, covering this eye, and you just say left or right, okay? Now everyone has a blind spot in the kind of bottom right area. Now again, just looking here, I'm going to move my hand down, and I want you to tell me when it disappears and when it reappears, okay? So we'll start up here. Okay. Gone, right. Back, okay. And disappeared. Okay. And reappeared. Good. Alright, now cover the eye we were just doing. Very good. And same again, looking here. Okay, and just blink a few times. I want to give your eyes a quick rest. Alright, same again. I'm going to start with my hand about here. Okay, you just looking here. And tell me when it disappears out of your side vision. Gone? Okay. Back, alright. Gone, okay. And it's back. Terrific. I think we're done with your eyes. Okay. I think lastly we're going to check your hearing, okay? Just put this down and grab my special tool, and you will recognize it from before. This is a tuning fork, okay? When struck, it holds a note for a long time. The vibrations travel freely around it, and it takes a while for them to dissipate. Okay, so what I'm going to do is lightly ping it. I'm going to hold it close to your ear, and I'm going to pinch it basically to stop it, and I want you to tell me when it stops, okay? Good. Do the same again. Can you still hear it? Very good. This time I'm just going to let it die out. You tell me when you can't hear it anymore. About now? Okay, good. We're going to do the same on this side. Can you hear that? Okay, now. One more time. Still going? Okay. And it stopped. Alright, great. And lastly, I'm gonna rustle, and you're gonna say left or right, and then I'm gonna say words into your ears, and you're just gonna repeat them back to me, okay? So rustling and then the words. Alright, so again, I'll need you to close your eyes because otherwise you'll clearly see which hand is moving. So fully closed, and just say left or right, okay? Very good. And now we're just going to do some more words. Ready? Eyes closed, please. Paper. Pipet. Pimple. Piano. Aubergine. Aubergine. Oblong. Oblong. Good, good, good. Good, good, good. Very good to meet you, sir. Very good to meet you, madame. Hello. Goodbye. 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 Auf Wiedersehen. Chair. Chair, chair, chair. Rain. Rainy day drive. 100,000 subscribers. Click the button now. Click the button now. Very good. Senses seem all in working order. I am going to refer you to an optician for a more thorough eye exam just to see what the possible reason is for the slowness on one side. Because if left untreated, that can turn into like a lazy eye or, you know, even impair your vision. So it's not serious now, but if you don't do something about it, it would become serious. But we're going to do something about it. Okay. Well, luckily the opticians are in the same building. Yep. He's a lovely bloke, handsome chap. You'll get on with him really well. Great. Alright, you can organise that date with him at your leisure. This is just a referral, and I've given him a little bit of background on what we're doing and why, so he's not going in completely blind. Very good. Well, It has been a pleasure to meet you. It's been a pleasure to examine you today. I'm incredibly stoked that you're nice and healthy. Okay, fantastic. Well, I will see you back here in 6 months to a year, hopefully. Okay.